اليوم نبغى upper limb lower limb revision and flex. Let's go. Boom, boom,
Hey guys, it's Medicosis Perfectionalis, where medicine makes joined. Back to this.
Thanks for the order. It's company, bro.
snails where medicine makes perfect sense. Today, we have a very quick review about anatomy of the lower extremities. We'll talk about thigh muscles, leg muscles, lumbar plexus, sacral plexus, arterial supply, venous drainage, and even lymphatic drainage. With that said, now let's get started. This video was made possible through the generous support of Dr. Alex, and he asked me to make this video available for free for everybody, especially for the wonderful medical students at AUA. Hopefully this video is going to help many students throughout the generations. Dr. Alex is leading. August 1 high for the up theory, like that, and upwards.
My tax money is going to pay for the very people who attacked me. A group of...
It's anterior. Where's your biceps femoris? It's posterior. See, medicine makes so much sense once you understand what the flip you're talking about. Now let's talk about thigh compartments. Imagine that you took a slice of your thigh. What's the name of the big bone in the middle of this? Is the femur. The anterior compartment is here, so it's going to flex the hip, which means the thigh is going to move upwards like this. They'll also the anterior compartment is here, so it's going to flex the hip, which means the thigh is going to move upwards like this. They'll also extend the knee like this. How about the medial compartment? They are the adductors of the hip. The hip is going to get closer to the midline. But what about the posterior compartment? The posterior compartment, or the hamstring muscles, are the flexors of the knee. Upwards like this. They'll also extend the knee like this. How about the medial compartment? They are the adductors of the hip. The hip is going to get closer to the midline. But what about the posterior compartment? The posterior compartment, or the hamstring muscles, are the flexors of the knee, as you see here. The anterior compartment muscles include quadriceps and sartorius. The quadriceps is made of 4 muscles: rectus, femoris, vastus, medialis, vastus lateralis, vastus intermedius. How about the medial compartment? These are the adductors of the hip. Adductors, so you have adductor longus, adductor brevis, adductor magnus. And don't forget the graceful gracilis and the piece of melon, pectineus. How about the flexors of the knee, or the posterior compartment, or the hamstring muscles? They are behind your femur. Imagine that you were driving down the highway and you looked in the rear view mirror to see 2 semi-trucks behind you, and you said, oops, 2 semi-trucks. 2 is bi, semi, and semi. Biceps, femoris, semicondinosus, semimembranosus. Now it's time to talk about the lumbosacral plexus. As you know, your nervous system is made of CNS and PNS. The central nervous system is brain and spinal cord. The peripheral nervous system is the cranial nerves and the spinal nerves. Spinal nerves are 8 in the cervical region, 12 in the thoracic, 5 in the lumbar, 5 in the sacral, only 1 in the coccygeal region. All spinal nerves are mixed. What does that mean? They have sensory, they have motor together. Here's a slice of your spinal cord, and happiness touch. Spinal. So plexus has 2 sacrococcygeal area. The spinal nerve is going to take the number of the vertebral body above it. So this is L1 vertebra, this is L1 spinal nerve. Lumbosacral plexus is made of lumbar plexus and sacral plexus. Lumbar plexus has 2 main loyal sons, the obturator nerve and the femoral nerve. Above the sacral plexus, 2 loyal daughters, sciatic nerve and pudendal nerve. Lumbar plexus, obturator and femoral. Sacral plexus, sciatic and pudendal. What's the sciatic nerve? It's a thick nerve, and it's actually like not one nerve, but 2 nerves lumped together. The tibial nerve medially and the common fibular nerve laterally. Do you remember the compartments of the thigh? Here is the view. The anterior compartment muscles are supplied with the femoral nerve. Posterior compartment supplied by the sciatic nerve. The medial compartment is supplied by the obturator nerve. Translation: the quadriceps muscle and the sartorius muscles are supplied by femoral nerve. Gracilis, pectineus, adductor longus, adductor brevis, adductor magnus are supplied by the obturator nerve. Moreover, biceps femoris, semicondinosus, semimembranosus are supplied by the sciatic nerve. Easy peasy, lemon squeeze. Oh, anatomy is just so hard and nothing makes sense. Oh, shut up. It makes sense. If explained, we have anterior, posterior, and lateral compartment, which is lateral to the fibula. The muscles of the anterior compartment are foot extensors. By extension here, I mean dorsiflexion. How about the posterior compartment? Foot flexors or plantar flexors. This way. Foot extensors. By extension here, I mean dorsiflexion. How about the posterior compartment? Foot flexors or plantar flexors. This way. How about the compartment of anterior division? Anterior division, posterior division. Foot is brevis. This nerve or superficial fibula, and anterior fibular nerve is the fibula. Foot flexors is extensor, digitorum brevis. and hernias tertius. How about the muscles of the posterior compartment, which are the foot flexors or plantar flexors? Gastrocnemius and soleus. Never ever forget these two. Plantaris popliteus, the two P's. So the two sisters and the two P's. And then two flexors. Flexor, hallucis longus, flexor, digitorum longus, and tibialis posterior. Not interior, posterior this time. How about the lateral compartment? Lateral is the fibula, and the fibular is peroneal. So we have two muscles here. You can call them hernias longus and hernias brevis, or fibular. Fibularis longus and fibularis brevis. What is the nerve supply of the leg compartments? Do you remember when we talked about the sciatic nerve? Yeah. And the sciatic nerve is made of two nerves, right? We have the tibial nerve posteriorly and the common fibular nerve. The common fibular nerve will subdivide into musculocutaneous nerve or superficial fibular and anterior tibial or deep fibular. The anterior tibial is for the anterior compartment. The superficial fibular is for the lateral compartment, and the tibial nerve is for the posterior compartment. Pause and reveal. So who's going to supply tibialis anterior extensor, and hernias? posterior tibial or deep tibial. The anterior tibial is for the anterior compartment, the superficial tibial is for the lateral compartment, and the tibial nerve is for the posterior compartment. Pause and review. So who's going to supply tibialis anterior extensor, and peroneus tertius? Anterior tibial nerve. Who's going to supply fibularis longus and fibularis brevis? This is the superficial fibular nerve. Who's going to supply gastrocnemius soleus, plantaris popliteus, flexor tibialis posterior? This is your posterior tibial nerve, or just tibial nerve. Here is the lumbar plexus, here is the sacral plexus. How do we bridge the gap between lumbar and sacral plexus? There is a beautiful, beautiful nerve that bridges the gap, and this is called the lumbosacral trunk. Look at this view. Let's start by talking about the lumbar plexus. Okay, where does it come from? Remember, the posterior ramus is useless, except for the skin and muscles of the back. Everything else is anterior or ventral embedded. Anterior division. Lumbar plexus, of course, come from anterior primary rami of L1 through L4. Where do I find them? Embedded within the fibers of the psoas major muscle. Each lovely lumbar spinal nerve is going to divide into anterior or ventral ramus. Ramus is useless, except for the skin and muscles of the back. Every nerve is going to divide into anterior. You get the obturator nerve. If you collect the posterior divisions of the same nerve, and there's the obturator, anterior divisions of L2. So easy, medicosis. Hold your horses. It's going to get nasty. Let's do it again. Anterior divisions of L2, 3. Hypogastric, ileo, inguinal, genital, femoral. How about L2? You already know that anterior is to the left of paper and draw dots. Who are the two loyal daughters of the sacral plexus? Oh, we have the sciatic nerve and the pudendal nerve. Since we're not talking about the pelvis and the perineum today, forget the pudendal nerve. Let's focus on the sciatic nerve. Is this one nerve? Well, yeah, it's one nerve made of two separate nerves. Medially, tibial nerve. Laterally, common fibular nerve. Near the tibia, near the fibula. The tibial nerve came from anterior divisions of L4, L5, S1, S2, and S3. How about the common fibular? Posterior divisions of L4, L5, S1, S2, and stop. There is no S3. S3 is only for tibial. The mnemonic is tibial is too much. Then it gets ridiculous. If you collect some posterior divisions from L4, L5, S1, you get superior gluteal nerve. Let's inch a little lower. So forget L4. We'll go L5, S1, and S2, and you'll have inferior gluteal nerve. Let's inch a little lower. So forget L5. Let's go S1, S2, nerve to the piriformis muscle. What are the two loyal daughters? Sciatic nerve and the pudendal nerve. S2, 3, 4, L4, 5, S1, 2, 3. Please draw it from scratch. Dermatomes. So umbilicus is next to T10, and then T11, T12, L1. We're getting close to the genitalia from the front, but on the back it's here. It's below the intergluteal cleft on the medial side hole. Then L2, L3 is getting larger. L4 is getting ridiculous. L4 supplies the hallux, which is the big toe. Then L5, middle toes, and then S1, little toe. From the back, there is no thoracic here, so this is L1, L2, L3, L4, L5, getting ridiculous, and we have two huge toys, S1 and S2. Have you ever seen a patient with sciatica? Yeah, they always complain of tingling and numbness on the back of the thigh, back of the leg. It makes perfect sense. Now let's take it to the next level. You remember that the lumbar plexus gave us what? It gave us the femoral nerve, the obturator, and lateral femoral cutaneous nerve. Forget the obturator. Let's focus on the femoral nerve and the lateral femoral cutaneous nerve. The lateral femoral cutaneous nerve is going to supply the skin, so sensory fibers, of the lateral part of the thigh, lateral part over the femur. How about the medial femoral cutaneous nerve? The medial part. How about the intermediate? It is here. See, lateral femoral cutaneous nerve came from L2 and L3. Makes perfect sense. Lateral part of the thigh. Medial and intermediate came from L2, 3, and 4, which makes perfect sense. Where does the posterior femoral cutaneous nerve come from? From the sacral plexus, not lumbar, sacral, and the root valley is S1, 2, 3. Here is S1, and here is S2. Let's talk about your foot. As you know, this is called dorsiflexion. This is called plantar flexion. Who's responsible for inferior foot? Here. See, lateral femoral cutaneous nerve came from femoral cutaneous nerve. Forget the obturator. Let's focus on the femoral nerve and the lateral femoral cutaneous nerve. The lateral femoral cutaneous nerve is going to supply the skin, so sensory fibers, of the lateral part of the thigh, lateral part over the femur. How about the medial femoral cutaneous nerve? The medial part. How about the intermediate? It is here. See, lateral femoral cutaneous nerve came from L2 and L3. Makes perfect sense. Lateral part of the thigh. Medial and intermediate came from L2, 3, and 4, which makes perfect sense. Where does the posterior femoral cutaneous nerve come from? From the sacral plexus, not lumbar, sacral, and the root valley is S1, 2, 3. Here is S1, and where femoral cutaneous nerve, the medial part. How about the intermediate? It is here. See, lateral femoral cutaneous nerve came from L2 and L3. Makes perfect sense. Lateral part of the thigh. Medial and intermediate came from L2, 3, and 4, which makes perfect sense. Where does the posterior femoral cutaneous nerve come from? From the sacral plexus, not lumbar.
Joy Forest. work, 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 work. I'm here in the shop, work, work. يلا الجلسة الثانية. next session, let's go. 3 2 1.
are sacral, and the root value is S1, 2, 3. Here is S1, and here is S2. So let's talk about your foot. As you know, this is called dorsiflexion. This is called plantar flexion. Who's responsible for dorsiflexion? If you're talking about the root, it's L4 and L5. If you're talking about the nerve, it's the common fibular nerve, or the anterior tibial, or the deep fibular. If you're talking about the muscle responsible for this, it's mainly the tibialis anterior. How about plantar flexion? If you're talking about the root value, S1, S2. The nerve is the tibial nerve, or the posterior tibial nerve. The muscles are the sisters, gastrocnemius and soleus. If you're going to be super sophisticated, dorsiflexion usually comes with inversion, same nerve and same root. Plantar flexion usually comes with eversion. Dorsiflexion with inversion, plantar flexion with eversion. What happens if I injure my tibial nerve, and what happens if I injure my super sophisticated dorsiflexion?
This year, the
This is the nerve of the anterior compartment of the thigh, and this is the nerve of the medial compartment of the thigh. Who makes the opposite nerves, right? We have the tibial nerve posteriorly and the common fibular nerve. The common fibular nerve will subdivide into musculocutaneous and spinal cord, the plexus. main loyal sons, the obturator nerve and the femoral nerve. How about the sacral plexus, two loyal daughters, sciatic nerve and pudendal nerve. Lumbar plexus, obturator and femoral. Sacral plexus, sciatic and pudendal. What's the sciatic nerve? It's a thick nerve, and it's actually like not one nerve, but two nerves lumped together. The tibial nerve medially and the common fibular nerve laterally. Do you remember the compartments of the thigh? Here is the beauty. The anterior compartment muscles are supplied with the femoral nerve. Posterior compartment supplied by the sciatic nerve. The medial compartment is supplied by the obturator nerve. Translation: the quadriceps muscle and the sartorius muscle are supplied by femoral nerve. Gracilis, pectineus, adductor longus, adductor brevis, adductor, which are the foot flexors or plantar flexors. Gastrocnemius and soleus, never ever. Sacral plexus. There's a beautiful, beautiful nerve that bridges the gap, and this is called the lumbosacral trunk. Femoral cutaneous nerve. Provide L45S123. Please draw it from scratch. Tibial is too much. Then it gets ridiculous. If you collect some posterior divisions from L4, L5, S1, you get superior gluteal nerve. Genitalia from the front, but on the back it's here. It's below the intergluteal cleft, on the medial side only. Then L2. L3 is getting larger. L4 is getting ridiculous. L4 supplies the hallux, which is the big toe. Then L5, middle toes. And then S1, little toe. From the back, there is no thoracic here, so this is L1, L2, L3, L4, L5, getting ridiculous. And then we have two huge stories, S1 and S2. Have you ever seen a patient with sciatica? Yeah, they always complain of tingling and numbness on the back of the thigh, back of the leg. It makes perfect sense. Now let's take it to the next level. You remember that the lumbar plexus gave us what? It gave us the femoral nerve, the obturator, and lateral femoral cutaneous nerve. Forget the obturator. Let's focus on the femoral nerve and the lateral femoral cutaneous nerve. The lateral femoral cutaneous nerve is going to supply the skin, so sensory fibers, of the lateral part of the thigh, lateral part over the femur. How about the medial femoral cutaneous nerve? The medial part. How about the intermediate? It is here. See, lateral femoral cutaneous nerve came from L2 and L3. Makes perfect sense. Lateral part of the thigh. Medial and intermediate came from L2, 3, and 4, which makes perfect sense. Where does the posterior hallucis longus, extensor digitorum The nerve is the tibial nerve or the posterior tibial nerve. The dorsiflexion with inversion, plantar flexion with eversion. What happens if I injure my tibial nerve, and what happens if I injure my common fibular nerve? They're the two components of the sciatic nerve. Let's go. Tibial nerve is S1, S2, mainly S1. Common fibular is L4 and L5, mainly L5. So basically we're comparing between S1 injury and L5 injury. You might think, oh, lumbar 5 and sacral number 1 are very close to each other. It doesn't matter. Shut up. It's a huge deal. It's a big difference. I injured my tibial nerve. Who's going to suffer? Gastrocnemius and soleus muscles. Therefore, who's going to suffer? Plantar flexion. If I can't plantar flex, what's going to happen? You will dorsiflex. And when you dorsiflex, you will never be able to walk on tiptoes. And you will not be able to walk downhill. downhill because you cannot walk on tippy toes. So when I injure my tibial nerve, I cannot walk on tippy toes. The symptoms caused by tibial nerve injury can be collectively called talipes calcaneal valgus. Let's talk about the injury to the common fibular nerve. Root, L5. Who's going to suffer? Tibialis anterior muscle. Who's going to suffer? Dorsiflexion. If I cannot dorsiflex, I will plantar flex. This is called foot drop or high stepped gait. Because when you walk in a weird way. It's as if you're stepping on eggshells or something. You cannot walk uphill because you cannot dorsiflex. These symptoms are known as talipes equinovalis. Some quick notes about that Grindelberg gait. First, let's talk normal, and then let's talk about the posture. Normally, you have superior gluteal nerve and inferior gluteal nerve. Both are branches of the who's going to suffer dorsiflexion. If I cannot dorsiflex, I will plantar flex. This is called foot drop or high steppage gait. Because when you walk in a weird way. It's as if your step has to reach. Normally, you have superior gluteal nerve and inferior gluteal nerve. Both are branches of the sacral plexus. L4, L5, S1, L5, S1, and S2.
Hey creators. What?
Here is gluteus maximus, here is gluteus medius, and gluteus minimus, and then you crisscross. Normally, the superior gluteal nerve supplies the gluteus medius and minimus, but the inferior gluteal nerve supplies the gluteus maximus. When you are arrogant, you will fall. You will rise like a superior glute. Some quick notes about that. Because when you walk in a weird way. It's as if you're stepping on eggshells or something. You cannot walk uphill because you cannot dorsiflex. These symptoms are known as talipes equinovarus. Some quick notes about that Rindenberg gait. First, let's talk normal, and then let's talk about the Normally, you have superior gluteal nerve and inferior gluteal nerve. Both are branches of the sacral plexus. L4, L5, S1, L5, S1, and S2. So, superior gluteal and then inferior gluteal. Here is gluteus maximus, here is gluteus medius and gluteus minimus, and then you crisscross. Normally, the superior gluteal nerve supplies the gluteus medius and minimus, but the inferior gluteal nerve supplies the gluteus maximus. When you are arrogant, you will fall, but when you have some humility, you will rise like a superior phoenix. So what the flip is, when you are arrogant, you will fall, but when you have some humility, you will rise like a superior phoenix. So what the flip is, basically, this is a patient with injury to the superior gluteal nerve. When I injure my superior gluteal nerve, who's going to suffer gluteus medius and gluteus minimus? What's going to happen? Pelvis is going to tilt down towards the opposite side because you cannot stabilize the ipsilateral side because you lost your ipsilateral superior gluteal nerve and you have weakness of the ipsilateral gluteus medius and minimus. Now pay attention to the upcoming sentence because it's freaking gold. You ask the patient to stand on the right leg. Then the left hip dropped. What's the problem? Well, this is the positive right Lindenberg sign. And it will give you right and left common iliac arteries. Each common aorta will give you descending thoracic aorta, abdominal aorta. Abdominal aorta will give you right and left common iliac aorta, aortic arch, descending thoracic aorta, abdominal aorta. Abdominal aorta will give you right and left common iliac arteries. Each common aorta will give you external iliac and internal iliac for the pelvis. External iliac will continue as femoral artery. Alright, so it's the same freaking vessel. Proximal to the inguinal ligament, here is the external iliac. Distal to the inguinal ligament, it's the femoral artery. And the vessel passes below or deep to the inguinal ligament. Now the femoral artery. It's going to give you a branch called the deep femoral artery. Listen to me carefully. When the professor asks you, what is the main arterial supply of the thigh? The answer is not the femoral artery. It is the deep femoral artery, the profunda femoris artery. This was profound. Don't forget this. This deep femoral artery will give you two circumflex branches. Medial circumflex femoral, lateral circumflex femoral. Okay, forget the deep femoral artery. Let's go back to the femoral artery. Femoral artery will continue here in the thigh, and then it will go backwards, behind your knee, in the popliteal fossa. It's going to change its name to the popliteal artery. The popliteal artery is going to give you anterior popliteal artery, which is going to go to the front of the leg. This anterior popliteal artery is going to continue as the dorsalis tibialis artery, which will end by anastomosing into the plantar arch. Forget the anterior popliteal. Let's go back to the popliteal artery and the popliteal fossa. It's going to continue downward as the posterior popliteal artery at the back of the leg, and it's going to end up by branching into medial plantar. plantar and lateral plantar. How about venous drainage? It's very similar to the arterial with a very famous exception. You have something called greater saphenous vein, the longest vein in your freaking body. Where does it drain to? It drains to the femoral vein, and it's going to end up. The artery is going to pop in the thigh, lateral circuit. Don't forget this. Artery. Listen to me carefully. When the professor asks you, what is the main arterial supply of the thigh? The answer is not the femoral artery. It is the deep femoral artery, the profunda femoris artery. This was profound. Don't forget this. This deep femoral artery will give you two circumflex branches. Medial circumflex femoral, lateral circumflex femoral. Okay, forget the deep femoral artery. Let's go back to the femoral artery. Femoral artery will continue here in the thigh, and then it will go backwards, behind your knee, in the popliteal fossa. It's going to change its name to the popliteal artery. The popliteal artery is going to give you anterior popliteal artery, which is going to go to the front of the leg. This anterior popliteal artery is going to continue as the dorsalis gluteus artery, which will end by anastomosing into the plantar arch. Forget the anterior popliteal. Let's go back to the popliteal artery in the popliteal fossa. It's going to continue downward as the posterior popliteal artery at the back of the leg, and it's going to end up by branching into medial plantar and lateral plantar. How about venous drainage? It's very similar to the arch. It drains to the femoral vein, and then you continue as usual. Here in the femoral group of lymph nodes. Here, how about I have more than 900 videos on this YouTube channel, and I have premium courses on my website, medicourses.com. Your superior iliac spine to that pubic ligaments. This is part 2. Please watch part 1 before this video. Thanks again for the fabulous Dr. Alex for supporting my channel. Let's review some ligaments. In the last video, we discussed the inguinal ligament, which extends from the anterior superior iliac spine to that pubic tubercle. Quick question: did the inguinal ligament just emerge out of the ether, out of nowhere? Of course not. It is part of the aponeurosis of the external abdominal oblique muscle. It's the lower free border of the aponeurosis of that muscle. The external iliac artery passes below the inguinal ligament, and then it's going to be transformed into a femoral artery. Same vessel, but different names because there are different locations. This is the pelvis, this is the lower limb. What do you see here? This is the inguinal ligament, which extends from the anterior superior iliac spine to that pubic tubercle. There is another smaller ligament here called the ligament of Cooper. Here is a tough question. What is the name of the other organ in your body that also has a ligament of Cooper? And the answer is the breast. After menopause, the suspensory ligament of Cooper of the female breast gets more lax. As you know, this is the hip bone, and it's made of 3 structures: the ilium, the ischium, the pubis. What's that hole here? It's the obturator foramen, which is mostly obliterated of the female breast gets more lax. As you know, this is the hip bone, and it's made of 3 structures: the ilium, the ischium, the pubis. What's that hole here? It's the obturator foramen, which is mostly obliterated by the obturator membrane that also has a ligament of Cooper. And the answer is the breast. After menopause, the suspensory ligament of Cooper of the female breast gets more lax. As you know, this is the hip bone, and it's made of 3 structures: the ilium, the ischium, the pubis. What's that hole here? It's the obturator foramen, which is mostly obliterated by the obturator membrane. This opening is known as the obturator canal. Note that the obturator nerve passes through the canal, and while in the canal, the obturator nerve is going to divide into anterior and posterior divisions. Let's look at the hip bone from the back. This is the back of the hip bone, this is the back of the sacrum. There is a wonderful ligament here called sacrospinous ligament. I love it because it extends from the sacrum to the ischial spine. Where exactly does it attach at the sacrum? Basically the lateral aspect of the last piece of the sacrum and the first piece of the coccyx. This wonderful sacrospinous ligament is going to divide this opening into 2 openings: the greater sciatic foramen above and the lesser sciatic foramen below. What are the structures that pass through the greater sciatic foramen? Ready? A wonderful muscle known as piriformis. And then above the piriformis muscle, you have superior gluteal artery, superior gluteal vein, superior gluteal nerve. Amazing. Below the piriformis muscle, you have inferior gluteal artery, inferior gluteal vein, inferior gluteal nerve. Okay? And don't you ever forget the sciatic nerve, as well as the posterior femoral cutaneous nerve. And then 2 small nerves: nerve to the obturator internus and nerve to quadratus femoris. Both are branched. Below the piriformis muscle, you have inferior gluteal artery, inferior gluteal vein, inferior gluteal nerve. Okay? And don't you ever forget the sciatic nerve, as well as the posterior femoral cutaneous nerve. And then 2 small nerves: nerve to the obturator internus and nerve to quadratus femoris. Both are branches of the sacral plexus. Then you have internal pudendal artery, internal pudendal vein, and pudendal nerve. Second, what are the structures passing through that lesser sciatic foramen? You have the tendon of the obturator internus, and you have some structures that just emerged from that greater foramen, and now they will go to the lesser foramen, and they include nerve to the obturator internus, internal pudendal vessels, and pudendal nerve. That was the first ligament. There is another ligament here, and this is called the sacrum tuberosity ligament. Which part of the sacrum? Well, lateral border of the sacrum, and don't forget this: the posterior segment of the iliac crest of the ilium, of the hip bone. And here it's attached to the ischial tuberosity. That's why it's called sacrotuberous ligament. Now let's take a break from these duty ligaments and let's go talk about nerves. As you know from the previous video, the lumbosacral plexus is made of lumbar plexus and sacral plexus. The lumbar plexus has 2 loreal sons: obturator nerve, femoral nerve. This is the nerve for the medial compartment of the thigh, and this is the nerve for the anterior compartment of the thigh. Next is the sacral plexus, which has 2 loreal daughters. You have the sciatic nerve and the pudendal nerve. The sciatic nerve is basically 2 nerves lumped together: the tibial and the common fibular. The sciatic nerve is the nerve of the posterior compartment of the thigh. The sciatic nerve passes below the piriformis muscle through the greater sciatic foramen, which is above the sacrospinous ligament. This is some clean anatomy right here. Now the gluteal region. What the foot is that? The gluteal region extends and the common fibula. The sciatic nerve is the nerve of the posterior compartment of the thigh. The sciatic nerve passes below the piriformis muscle through the greater sciatic foramen, which is above the sacrospinous ligament. This is some clean anatomy right here. Now the gluteal region, what the flip is that? The gluteal region extends from the iliac crest superiorly to the gluteal fold inferiorly, and from the intergluteal cleft or the natal cleft medially to a line that extends from anterior superior iliac spine to the greater trochanter of the femur laterally. Now let's talk about the muscles that are in the gluteal region. So here's the deal. If your anatomy professor says, hey student doctors, today we'll talk about the muscles of your butt, this is very inappropriate. But when the anatomy professor says, today we'll talk about the muscles of the gluteal region, this is an amazing scientist who is serving the community. Serving the community, my butt, no pun intended. I think I should shut up. Muscles of the gluteal region can be subdivided into three groups. The tensor fascia lata alone, the three gluteal muscles, gluteus maximus, gluteus medius, gluteus minimus, and 6 lateral or external rotators of the hip joint. And they include piriformis, quadratus femoris, obturator internus, obturator externus, superior gemellus, inferior gemellus. So, IS, 2 obturators, 2 gemelli. In this rotators of bone, the 3 gluteal muscles, gluteus maximus, gluteus medius, gluteus minimus, and 6 lateral or external rotators of the hip joint. And they include piriformis, quadratus femoris, obturator internus, obturator externus, superior gemellus, inferior gemellus. So, IS, 2 obturators, 2 gemelli. In the previous video we talked about that inferior gemellus. So, IS, 2 obturators, 2 gemelli. In the previous video we talked about the Trundenberg gate. And as you remember, the superior gluteal nerve supplies gluteus medius, gluteus minimus, and tensor fascia lata. Inferior gluteal nerve supplies the gluteus maximus. Because this is so huge, it's enough for the inferior gluteal nerve. Now let's talk about these 4 big muscles. Tensor fascia lata, gluteus maximus, which is the thickest, biggest muscle in your entire body. I'm talking about skeletal muscles, of course. Gluteus medius, and then gluteus minimus. If you have watched my videos for a long time, you know that I always tell you, jokingly, that I will kick you in the gluteus maximus. But I never say that I'm gonna kick your gluteus minimus. You know why? Because even if I want to kick it, I can't. Because this is so deep, it is covered by the gluteus medius, which is covered by the gluteus maximus. So I cannot reach your gluteus minimus. And this is huge. You know why? Because the origin of the gluteus minimus is the gluteal aspect of the ilium. Now let's talk about these 4 big muscles. Tensor fascia lata, gluteus maximus, which is the thickest, biggest muscle in your entire body. I'm talking about skeletal muscles, of course. Gluteus medius, and then gluteus minimus. If you have watched my videos for a long time, you know that I always tell you, jokingly, that I will kick you in the gluteus maximus. But I never say that I'm gonna kick your gluteus minimus. You know why? Because even if I want to kick it, I can't. Because this is so deep, it is covered by the gluteus medius, which is covered by the gluteus maximus. So I cannot reach your gluteus minimus. And this is huge. You know why? Because the origin of the gluteus minimus is the gluteal aspect of the ilium. How about the origin of the gluteus medius? Same. It's also the ilium, but it takes a bigger area. Oh, that's why it's covering the gluteus minimus. How about the gluteus maximus? A bigger area and even beyond the gluteus medius. Like here. What the flip are we trying to accomplish? Hip abduction. Oh, if you want to abduct the hip, you better be attached to the hip bone and insert into the lateral aspect of the femur. See, medicine makes so much sense once you understand what the flip you're talking about. So the tensor fascia lata originates from the outer lip of the iliac crest until the anterior border of the iliotibial tract, which is very strong fascia. The iliotibial tract is part of fascia lata. And what's the function of this lovely muscle? To tense the fascia lata. It's also an abductor. Imagine my shock. Gluteus maximus originates from the posterior surface of the ilium, posterior surface of the sacrum, posterior surface of the sacrotuberous ligament, and it inserts into the gluteal tuberosity of the femur and the posterior border of the iliotibial tract, right here. Function, hip abduction, hip extension, and hip lateral rotation. Look at this. You get the insertion fascia lata. And what's the function of this lovely muscle? To tense the fascia lata. It's also an abductor. Imagine my shock. Gluteus maximus originates from the posterior surface of the ilium, posterior surface of the sacrum, posterior surface of the sacrotuberous ligament, and it inserts into the gluteal tuberosity of the femur and the posterior border of the iliotibial tract, right here. Function, hip abduction, hip extension, and hip lateral rotation. Look at this. You get the insertion close to the origin, and you will rotate the hip laterally. Gluteus medius takes from the posterior surface of the ilium until the greater trochanter of the femur, and hip abduction, hip medial rotation. This is kind of weird. The gluteus minimus has the same function as the gluteus medius. Both of them, by the way, prevent the hip from tilting to the opposite side. And this is the essence of that Trendelenburg gait that was discussed in the previous video. Why do I get the Trendelenburg gait? Because you injured your superior gluteal nerve. Ah, it makes sense now. Remember that your lumbar plexus gave you femoral nerve, obturator nerve, iliohypogastric, ilioinguinal, genitofemoral, and lateral femoral cutaneous nerve. Your sacral plexus gave you the sciatic nerve, the pudendal nerve, superior gluteal nerve, inferior gluteal nerve, nerve to piriformis, and others. Now let's turn our attention to the lateral or external rotators of the hip. Think about it. If I'm gonna rotate the hip externally, I better attach myself to the hip and sacrum right here, and I better insert into the femur in order to pull it this way and rotate it externally. We have 6 muscles here: piriformis, quadratus femoris, and then we have 2 obturators, obturator externus and obturator internus. Above the obturator internus, we have superior gemellus, Below it we have inferior gemellus. What are the actions of all of them? External rotation of the hip. Nerve supply. The piriformis is very close to the sacral plexus. It's going to take from S1 and S2. Quadratus femoris is a rectangular quadrum or quadrate, which means 4 muscle, and it's going to take from its nerve. It has an own nerve to quadratus femoris. The obturator internus has a nerve, but the obturator externus does not have a nerve because it's very close to the obturator nerve. It's just going to take from the obturator. Remember when the obturator nerve passed through the obturator canal? Yup. This is above the obturator externus. Makes perfect sense. The obturator internus or because it's very close to the rectangular quadrum or quadrate, which means gemellus. What are the actions of all of them? External rotation of the hip. Nerve supply. The piriformis is very close to the sacral plexus. It's going to take from S1 and S2. Quadratus femoris is a rectangular quadrum or quadrate, which means 4 muscle, and it's going to take from its nerve. It has an own nerve to quadratus femoris. The obturator internus has a nerve, but the obturator externus does not have a nerve because it's very close to the obturator nerve. It's just going to take from the obturator. Remember when the obturator nerve passed through the obturator canal? Yup. This is above the obturator externus. Makes perfect. Take from S1 and S2. Quadratus femoris of the hip. Nerve supply. The piriformis is very close to the sacral plexus. It's going to take from S1 and S2. Quadratus femoris is a rectangle. Nerve supply. The piriformis is very close to the sacral plexus. It's going to take from S1 and S2. Quadratus femoris is a rectangular quadrum or quadrate, which means 4 muscle, and it's going to take from its nerve. It has an own nerve to quadratus femoris. The obturator internus has a nerve, but the obturator externus does not have a nerve because it's very close to the obturator nerve. It's just going to take from the obturator. Remember when the obturator nerve passed through the obturator canal? Yup. This is above the obturator externus. Makes perfect sense. The obturator internus originates from the inner aspect of the the obturator membrane, but the obturator externus is from the outer aspect of the obturator membrane. Quadratus femoris originates from the lateral border of the ischial tuberosity. Piriformis arises from the anterior surface of the middle three sacral pieces. Piriformis is the muscle that passes through the... This makes perfect sense. The obturator internus originates from the inner aspect of the obturator membrane, but the obturator externus is from the outer aspect of the obturator membrane. Quadratus femoris originates from the lateral border of the ischial tuberosity. Piriformis arises from the anterior surface of the middle three sacral pieces. Piriformis is the muscle that passes through the greater sciatic foramen, dividing the structures that pass through the foramen into structures above the piriformis and structures below the piriformis, including the sciatic nerve. Now let's leave your glute above the piriformis and structures below the piriformis. Including the sciatic nerve. Now let's leave your your gluteal region and talk about your thigh. You have three compartments: anterior compartment of the thigh, posterior compartment, medial compartment. Who supplies the anterior? Femoral nerve. Who supplies the medial? Obturator nerve. Who supplies the posterior? The sciatic nerve. What are the muscles of the anterior compartment? Quadriceps and sartorius. Functions: flex the hip, extend the knee, like this. Functions of the medial compartment muscles: adduct the hip, bring the hip closer to the midline, which makes sense because they are medial. And they include gracilis, pectineus, the graceful, the piece of melena, and three adductors: adductor longus, adductor brevis, adductor magnus. Then you have the posterior compartment. What are the muscles? Biceps, femoris, semitendinosus, semimembranosus. You were driving down the highway. You looked at the rear view mirror and you saw two semi-trucks flexing on you. So you said, oops. Let's talk about the adductors of the hip, the graceful, gracilis, the piece of melena, pectineus, and three adductors. If I'm gonna adduct the hip, of course I'm gonna originate here and insert here. So that I pull this way, yep, and adduct. All of these muscles originate from the pubes. That's awesome. Don't you love anatomy? Yeah. All of them insert to the linea aspera of the femur. All of them, except the gracilis, which inserts below on the tibia. Don't you love anatomy? Oh, hell no. So gracilis has disobeyed the rule. It's not as graceful as you think. It has descended into chaos. Let's go, baby. Gracilis. Where do you start? Of course, I have to start at the pubis, which makes sense. All of them start in femoris, semitendinosus, semimembranosus. You were driving down the highway. You looked at the rear view mirror and you saw two semi-trucks flexing on you. So you said, oops. Let's talk about the adductors of the hip, the graceful, adductor brevis. And they include gracilis, pectineus, the graceful, the piece of melena, and three adductors: adductor longus, adductor brevis, adductor magnus. Then you have the posterior compartment. What are the muscles? Biceps, femoris, semitendinosus, semimembranosus. You were driving down the highway. You looked at the rear view mirror and you saw two semi-trucks flexing on you. So you said, oops. Let's talk about the adductors of the hip, the graceful, gracilis, the piece of melena, pectineus, and three adductors. If I'm gonna adduct the hip, of course I'm gonna originate here and insert here. So that I pull this way, yep, and adduct. All of these muscles originate from the pubes. That's awesome. Don't you love anatomy? Yeah. All of them insert to the linea aspera of the femur. All of them, except the gracilis, which inserts below on the tibia. Don't you love anatomy? Oh, hell no. So gracilis has disobeyed the rule. It's not as graceful as you think. It has descended into chaos. Let's go, baby. Gracilis. Where do you start? Of course I have to start at the pubis, which makes sense. All of them start in the pubis. Where do you end? Upper part of the tibia. Yeah, I'm not so graceful. I go below. I descend into the abyss. How about you, pectineus? Well, I take from here, pectineal line of the hip bone, which is in the pubis, until the upper half of the pectineal line of the femur. You can call it pectineal line or linea pectinatum. How about you, adductor longus? I start from the body of the pubis until the linea aspera of the femur. How about you, brevis? Very close. Body of the pubis to the linea aspera of the femur. How about you, magnus? I'm magnificent. I'm magnanimous. I'm superior. I'm super big. I start at the ischial tuberosity and the ischial pubicrimus. I am so magnanimous, I have two insertions. First insertion, linea aspera of the femur. Second insertion, adductor tubercle of the femur. What's that hole right here? I'm glad you asked, because this is the adductor hiatus. Who passes here? Who passes here? The femoral vessels. Oh, the femoral artery is going to pass here. And it's going to go behind the femur to become the popliteal artery. Very important. Let's leave the medial compartment and let's focus on the anterior compartment. Big. I start at the ischial tuberosity and the ischial pubicrimus. I am so magnanimous, I have two insertions. First insertion, linea aspera of the femur. Second insertion, adductor tubercle of the femur. What's that hole right here? I'm glad you asked, because this is the adductor hiatus. Who passes here? Who passes here? The femoral vessels. Oh, the femoral artery is going to pass here. And it's going to go behind the femur to become the popliteal artery. Very important. Let's leave the medial compartment and let's focus on the anterior compartment. The biggest one is the quadriceps muscle. One muscle made of four pieces: rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. These four doofuses have different origins, but one common insertion. Let's talk about the insertion. They insert into the patella. And then they continue to form the patellar ligament, or ligamentum patellae, until they end up at the tibial tuberosity. This is huge, because there is some clinical anatomy here. Integration, baby. There is a disease known as Osgood-Schlatter disease, which is apophysitis tendinosis of the tibial tuberosity and inflammation of the patellar ligament, where you can feel a painful bump in front of the knee. The patient is usually a male adolescent between ages 10 and 15. Because teens are running all the time, overusing their joints, that's why they get apophysitis. Teens are also kissing all day, that's why they get infectious mononucleosis. Integration, baby. How do you treat Osgood-Schlatter disease? Some rest, some ice, some ibuprofen. Who supplies the quadriceps muscle? Since this is the anterior compartment, of course it's going to be the femoral nerve. Duh! Why do we need the quadriceps? Hip flexion, knee extension. Now, the longest skeletal muscle in your body, sartorius, baby, which literally means the tailor. Why? Because tailors, in the good old days, which were not so good, used to cross their legs while working. This muscle helps you cross your leg. Origin, anterior superior iliac spine. Insertion, upper part of the medial surface of the tibia. So don't forget, gracilis began here and ended here, but sartorius starts here and ends here. So the origin of the sartorius and the gracilis is different, but the insertion is very close. There is another muscle that inserts very close to them, and this is the semitendinosus, but the semitendinosus is more posterior. Sartorius is a muscle of the anterior compartment, therefore femoral nerve. Next, let's talk about the psoas major and the iliacus, together known as the iliopsoas muscle. Why? Because they will join each other and they will have a common insertion. Where the flip is the insertion, lesser trochanter of the femur. But where's the origin? Oh, we have different origins here. When it comes to the iliacus, it's easy, from the anterior surface or the pelvic surface of the ilium. This part is known as the iliac fossa. Also, let's take from the inner lip of the iliac crest, and let's take from the ala of the sacrum. How about you, psoas major? Well, I originate here from the anterior surface and the lower border of what? Of all lumbar transverse processes. But wait, it gets worse. I also originate from the intervertebral discs between them, and I make some glorious tendinous arches like this. Note that the iliopsoas tendon is gonna pass behind or deep to the inguinal ligament. You mean posterior to the ligament? Absolutely. Together with the femoral nerve and femoral vessels? Absolutely. All of these structures pass below the inguinal ligament, which extends from the anterior superior iliac spine towards the pubic tubercle. What are the functions of the iliopsoas? Flexion and medial rotation of the thigh. Easy. Flexion of the pelvis over the thigh. Makes sense. You know when you go to the gym and do sit-ups? Yep, you're using your iliopsoas muscles. The psoas major alone can perform lateral flexion of the vertebral column. Swing to the right, swing to the left. Let's have a quick review. This is your psoas major muscle. This is your iliacus muscle. The beautiful muscle here, the longest muscle of your body, sartorius. How about this one? Gracilis. Pectineus is here, adductor longus is here. Behind them, there is adductor brevis. Behind them, there is the adductor magnus. Where is my beautiful quadriceps? Yeah, here. The quadriceps has 4 pieces. Rectus femoris is here. Behind it, you'll find vastus intermedius. Here is vastus medialis and vastus lateralis. Who's this right here? This is the iliotibial tract. And what's that? The tensor fascia lata. What's that big rectangular muscle here next to the psoas major? This is called quadratus lumborum. Quadratus means rectangular. Lumborum because it's near the lumbar vertebrae. We're done with the anterior compartment, we're done with the medial compartment. It's time to talk about the posterior compartment. It's near here. Where is my the psoas major alone? And flexion and medial rotation of the thigh. Easy. Flexion of the pelvis pass below the inguinal ligament, which extends from the anterior superior iliac spine towards the pubic tubercle. What are the functions of the iliopsoas? Flexion and medial rotation of the thigh. Easy. Flexion of the pelvis over the thigh. Makes sense. You know when you go to the gym and do sit-ups, yep, you're using your iliopsoas muscles. The psoas major alone can perform lateral flexion of the vertebral column. Swing to the right, swing to the left. Let's have a quick review. This is your psoas major muscle. This is your iliacus muscle. The beautiful muscle here, the longest muscle of your body, sartorius. How about this one? Gracilis. Pectineus is here, adductor longus is here. Behind them, there is adductor brevis. Behind them, there is the adductor magnus. Where is my longus is here? Behind them, sartorius. How about this one? Gracilis. Pectineus is here, adductor longus is here. Behind them, there is adductus. How about this one? Gracilis. Pectineus is here, adductor longus is here. Behind them, there is adductor brevis. Behind them, there is the adductor magnus. Where is my beautiful quadriceps? Yeah, here. The quadriceps has 4 pieces. Rectus femoris is here. Behind it, you'll find vastus intermedius. Here is vastus medialis and vastus lateralis. Who's this right here? This is the iliotibial tract. And what's that? The tensor fascia lata. What's that big rectangular muscle here next to the psoas major? This is called quadratus lumborum. Quadratus means rectangular. Lumborum because it's near the lumbar vertebrae. We're done with the anterior compartment. We're done with the medial compartment. It's time to talk about the posterior compartment of the thigh. Posterior compartment. What's the function? Extension of the hip, flexion of the knee. And they include biceps femoris, semitendinosus, semimembranosus. Biceps femoris is here. Why do they call it biceps femoris? Because it has 2 heads at its origin. Short head and long head. Very similar to the biceps brachii. Where does it insert? It inserts into the fibula. Can you be specific? The head of the fibula. We're done with the biceps femoris. Then you have semitendinosus, followed by semimembranosus. What's the name of this area? Popliteal fossa. Who's gonna emerge from here? Don't forget your popliteal artery, popliteal vein, and tibial nerve. The muscles of the posterior compartment are supplied by the sciatic nerve, of course. We're done with the thigh. In the previous video, we hinted about the leg compartments. I strongly encourage you to read this and then make your own tables. Make a comparison table, Vince. I strongly encourage you to read this and then make your own tables. Make a comparison. We're done with the thigh. In the previous video, we hinted about the leg compartments. I strongly encourage you to read this and then make your own tables. Make a comparison table for the anterior compartment, another table for the posterior compartment, a third table for the lateral compartment. Good luck. Don't forget their nerve supply. And here is a slide for the anterior compartment and a slide for the posterior compartment. If you like this video, I have premium buy. And here is a slide for the anterior compartment and a slide for the posterior compartment. If you like this video, I have premium videos on my website, medicosisperfectionalis.com, such as the cardiac pharmacology course and the otocoids pharmacology course. Please take a few seconds.
Hello, in this video we're going to look at anatomy of the thorax. So here I'm drawing the rib cage, the thorax area from an anterior view. And here at the back is our vertebrae, the thoracic vertebrae. We have 12 in total, so T1 all the way to T12. And I'm also adding the lumbar one, the lumbar vertebrae number 1. Coming off the thoracic vertebra 12, so T12, we have the 12th rib, which is a floating rib here. Here is our clavicle and scapula. Now the ribs originate from the vertebra and connect to the sternum. The ribs actually joining to the sternum form cartilage, allowing for the expansion of the thorax during respiration. The sternum itself forms 3 parts: the manubrium of the sternum, the body of the sternum, and the xiphoid process of the sternum. Drawing the sternum from a side view now, it is important to appreciate an important landmark, which is marked by the sternal angle between the manubrium and the body of the sternum. This surface marking is also referred to as the angle of Louis. On the side view of the sternum, we can see the insertion points of the ribs. Rib 1 attaches onto the manubrium, rib 2 to the sternal angle, rib 3 to 6 to the body of the sternum. And here is the xiphisternal joint. And on top here is the clavicular notch, where the clavicle attaches. The clavicle and sternum make up the sternoclavicular joint. Now, as I said, the sternal angle, or the angle of Louis, is an important landmark because many structures can be found along this angle. So if we were to cut straight along in a horizontal plane along the sternal angle, we will hit and find these things, such as the joint between thoracic vertebra 4 and 5, so T4-5. The second rib articulation occurs here. We can find the aortic arch, zygous vein as well, entering into the heart. We have the ligamentum arteriosus. We have the left recurrent laryngeal nerve. We can also find the bifurcation of the pulmonary trunk and bifurcation of vertebra 4. If we were to cut straight along in a horizontal plane along the sternal angle, we will hit and find these things, such as the joint between thoracic vertebra 4 and 5, so T4-5. The second rib articulation occurs here. We can find the aortic arch, zygous vein as well, entering into the heart. We have the ligamentum arteriosus. We have the left recurrent laryngeal nerve. We can also find the bifurcation of the pulmonary trunk and bifurcation of the trachea. Now let's talk a bit more about ribs. So ribs can be divided into true, false, and floating. True ribs are also known as the vertebrocostal ribs, which are ribs 1 to 7. These are ribs that originate from the vertebra and join to the sternum through the costal cartilages. Then you have false ribs, or vertebro-bronchocondyl ribs, which are ribs 8, 9, 10. And these ribs originate from the vertebra and attach to the sternum by joining to the cartilages of ribs 6 and 7. Finally, you have floating ribs, or the vertebro-rib-free ribs, which are ribs 11 and 12. These are the ribs that originate from the vertebra, but don't attach anywhere.
Yo. Let's go for our next wrist. No one in the chat, of course. Alright.
Our ribs can also be divided into typical and atypical. Typical ribs are ribs with similar features, typical features, and these ribs are ribs 3 to 9. Atypical ribs are different from each other and other ribs, and are ribs 1, ribs 2, and ribs 10 to 12. Okay, ribs are ribs 3 to 9. Atypical ribs are different from each other and other ribs, and are ribs 1, ribs 2, and free ribs, which are and 7. 2 apochondral ribs, which are ribs 8, 9, 10. And these ribs originate from the vertebra and attach to the sternum by joining to the cartilages of ribs 6 and 7. Finally, you have floating ribs, or the vertebra free ribs, which are ribs 11 and 12. This can also be divided into typical and atypical. Typical ribs are ribs with similar features, typical features, and these ribs are ribs 3 to 9. Atypical ribs are different from each other and other ribs, and are ribs 1, ribs 2, and ribs 10 to 12. Okay, now let's look at a posterior view of the thorax, the rib cage. Here I'm drawing the vertebrae again, the clavicle and scapula, and here are ribs 1 to 12. Here is the scapular clavicle, and here is the lumbar vertebra 1. Let's talk about the vertebrae quickly, just for a quick recap. We are looking at a vertebra from a superior view. This is T1, and here is the body. The vertebral foramen is where the spinal cord goes through. The peduncle, we have the transverse process, and then we have the spinous process, which we can actually feel when we palpate along the spine. So here is the thoracic vertebra 6, T6, which is very spinal cord, goes through the peduncle, we have the transverse process, and then we have the spinous process, which we can actually feel when we palpate along the spine. So here is the thoracic vertebra 6, T6, which is very similar to the previous vertebra, but something else that is very important to introduce is the facets where ribs articulate, and this is specifically for the thoracic vertebrae because they have ribs coming off them. Finally, we have T12, very much the same with other thoracic vertebrae, but T12 especially becomes bigger when we go towards the lumbar vertebrae. Okay, next let's look at where organs and other things lie in respect to the thoracic cavity. So this is an anterior view again. Now roughly along the 5th rib is where the diaphragm sits. Important landmarks to remember is the mid-clavicula, which is essentially the site from, if we draw a line from the middle of the clavicle down. So this is mid-clavicula. There's also mid-scapula, which is a landmark at the back, the middle of the scapula. The mid-axillary is the landmark for the lateral aspects of the thorax along the armpits. These landmarks are important to know because of several reasons, one of which is to help identify where the lung sits in respect to the thoracic cavity, and also the pleural flow, or the pleura itself. So next, let's talk about the surface landmarks of the lung itself, and also the parietal pleura. So again, the pleura is essentially a membrane that covers our lungs, and the pleura can be divided into parietal and visceral pleura. Visceral pleura is the one that covers all our lungs, and the parietal pleura is the layer above it. So the margins of the lung, mid-clavicula, it goes to the 6th rib, mid-axillary to the 8th rib, and mid-scapula, the 10th rib. So the margins of the lung, mid-clavicula, it goes to the 6th rib, mid-axillary to the 8th rib, and mid-scapula, the 10th rib. So if I were to draw it out on this diagram, it would be something like this. So mid-axillary, it goes to the 8th rib, the lung, and then mid-clavicula, it is on the 6th rib, and at the back mid-scapula, the lung margin is on the 10th rib, and then mid-clavicula would be something like the 8th rib. So the margins of the lung, mid-clavicula, it goes to the 6th rib, mid-axillary to the 8th rib, and mid-scapula, the 10th rib. So if I were to draw it out on this diagram, it would be something like this. So mid-axillary, it goes to the 8th rib, the lung, and then mid-clavicula, it is on the 6th rib, and at the back mid-scapula, the lung margin is on the 10th rib. The pleura here in blue, and at the back mid-scapula, it goes to the 8th rib, the lung, and then mid-clavicula, it is on the 6th rib, and at the back mid-scapula, the lung margin is on the 10th rib. The pleura here in blue goes further down. You essentially add 2 to find the margins of the pleura. So mid-axillary, it's at rib 10, mid-clavicula, it's rib 8. So margin of the pleura, mid-clavicula, plus 2 is 8. Mid-axillary is 10, and mid-scapula is 12. I hope that makes sense. Now the margins of the lung at pleura on the left side of the thorax is slightly different because of where the heart is situated. The heart sits somewhere here, because remember, the aorta goes up and it's behind the sternal angle. Again, here in red, I'm drawing the margins of the lung. The margins of the lung on the left side, instead of being mid-clavicular on the 6th rib, it is mid-clavicular on the 4th rib. It goes down to being mid-axillary on the 8th rib, then everything else is the same. So it's just where the heart is that makes the left and right lung margins and pleura margins slightly different. Just to finish off this diagram, the liver, or most of the liver, can be found under our ribs for protection. Now, let's look at what problems can occur in the thoracic cavity. Let's look at a pulmonary collapse, a result of a pneumothorax. A collapsed lung is also referred to as atelectasis. So normally here is our lung. Surrounding our lung is the visceral pleura, then our parietal pleura. In between the visceral and parietal pleura, we have the pleural cavity, which helps lubricate the layers and keep them stuck together. And here is the cardiac area where the heart sits. Remember, air moves in and out as we inhale and exhale. A pneumothorax can occur because of something external puncturing the pleural layer, the parietal layer, resulting in air moving into the pleural cavity. This results in air filling the parietal pleura, the pleural cavity, and forcing the lungs to deflate, essentially. So injury results in puncturing of the parietal pleura. The punctured parietal pleura allows air to enter the pleural cavity. Air entering the pleural cavity, external diseases such as COPD, or in tall, skinny people who have predisposition for spontaneous pneumothorax. So I hope you enjoyed this video. Thank you for watching. Mid scapula is 12.
Xiphisternal.
واحدة من العضلات، آخر عضلة هي نسيت اسمها يا حب. آخر عضلة هي المفروض downward and medial تقريبا، هو كاتبها literally. هذي قبل نحس فيها خطأ وتو نحس فيها صح، مش عارف ليش. قصديك انت حقي لها هي الاندت وين تحقي فوق والقدام، فهمت كيف؟ لكن السلوبنج هي مثلا القصة هيك جت مثلا ولا كيف، كي مايلة بشكل تاني، مايلة تلف فيها صح downward and anti or forward يعني.